Hey everyone, welcome back. Today we're going to be looking at some trending tidbits all about shoulder injuries.
Sounds good.
Yeah, we've got three sources that we're going to be looking at. One about how accurate some common diagnostic tests are. One that's looking into how we can quantify resistance training for these injuries. And then another that's, well, it's a trial that look into whether more exercise is always better when it comes to shoulder rehab. So kind of covers the whole spectrum from diagnosis all the way through to treatment.
Yeah, definitely. And it seems like a lot of people are really interested in this topic too, based on what I've seen.
Yeah, for sure. Yeah, I mean, shoulder injuries, they can really impact anyone, right? Like
Oh,
whether you're
absolutely.
an athlete or, just someone who's lifting boxes.
Yep. Everyday activities. Even just sitting at a desk all day can cause problems if you're not careful.
Exactly. So much good stuff to unpack here. Why don't we just jump right in?
Let's do it.
All right. So the first source we're looking at is this study on diagnostic accuracy for shoulder injuries. And honestly, I was pretty surprised by some of the findings.
Oh, yeah. How so?
Well, I think a lot of people kind of assume that shoulder diagnoses are a bit of a guessing game. Like there's so much going on in there that it's hard to pinpoint exactly what's wrong.
Yeah, I can see how you'd think that. But this study actually found that 10 specific tests were highly accurate in diagnosing certain shoulder conditions.
Really? That's impressive. What kind of tests are we talking about?
Well, they looked at things like the apprehension test for anterior instability,
Okay.
the Hawkins-Kennedy test for impingement, and the biceps load 2 test for SLAP tears, just to name a few.
And those were all super accurate. Like how accurate are we talking?
They used a measure called likelihood ratios, or LRs, to determine the accuracy.
Okay, so break that down for me. What exactly is a likelihood ratio?
Sure, so basically a likelihood ratio tells you how much more likely it is that someone has a condition if they test positive on a particular test compared to someone who tests negative.
Okay, I think I'm following. So a high likelihood ratio means the test is pretty good at ruling things in or out.
Exactly. For example, the apprehension test for anterior instability had an LR plus of 17.21.
Wow, that's pretty high.
Yeah, it means that if you test positive on that test, you're 17 times more likely to actually have anterior instability.
That's pretty reassuring if you're a clinician trying to make a diagnosis.
Right, it takes away a lot of the guesswork. And another standout was the biceps load 2 test for SLAP tears. That one had an LR plus of 26.38.
Wow, okay. So these tests can really make a difference in helping clinicians figure out what's going on with someone's shoulder.
Absolutely. They're powerful tools for getting to the root of the problem.
So diagnosis is key.
Yeah.
Got it. But once you know what's wrong, how do you actually go about fixing it?
Well, that's where the second source comes in. This one's a research protocol that's looking into resistance training for shoulder injuries.
Okay, so this is about the treatment side of things.
Exactly. And one of the challenges they highlight is that resistance training can be really difficult to standardize.
What do you mean?
Well, there are so many different protocols and ways to do resistance training that it can be tough to compare apples to apples. Like if one study uses dumbbells and another uses resistance bands, how do you know if they're really comparing the same thing?
Yeah, that makes sense. So how does this research protocol address that challenge?
They propose using a measure called total training volume, which is basically just the total number of sets performed per week.
So regardless of whether you're using dumbbells, resistance bands, or even body weight exercises,
Yeah,
you can still quantify the overall workload on the shoulder.
exactly. And that makes it much easier to compare different training approaches and see what works best.
Interesting. So does that mean more sets are always better?
Well, that's where the third source comes in. This one's a trial that looked at whether adding a large dose of shoulder strengthening to standard care actually led to better outcomes for people with subacromial impingement.
Subacromial impingement.
Yeah.
That's a pretty common shoulder problem, right?
Yeah, it's one of the most common causes of shoulder pain.
So what did they find? Did all that extra exercise help?
Actually, no, it didn't.
Really? That's surprising. I thought more exercise was always a good thing.
It's a common assumption, but this study challenges that notion. It seems there might be a sweet spot when it comes to exercise volume.
So more isn't always better.
Not necessarily, and one of the reasons they think this might be the case is because of patient adherence.
Meaning people had trouble keeping up with all those extra exercises.
Yeah, it's understandable. Life gets in the way, motivation can fluctuate, and sometimes too much exercise can actually lead to fatigue and soreness, which makes the pain worse.
That makes sense. If you're pushing yourself too hard and not giving your body enough time to recover, you could end up doing more harm than good.
Exactly. So it's all about finding that balance between challenging yourself and listening to your body.
So how do you find that balance? Is there like a magic number of sets or exercises people should be doing?
Unfortunately, there's no one-size-fits-all answer. It depends on so many factors, like the specific shoulder condition, your individual fitness level, and how your body responds to exercise.
So it's not just about blindly following a cookie-cutter exercise program,
Definitely not. You need to be mindful and adjust based on your own needs and limitations.
which is probably why it's so important to work with a qualified physical therapist or athletic trainer.
Absolutely. They can help you develop a personalized plan that takes into account your specific situation.
Okay, so we've covered a lot of ground already. We've got some powerful diagnostic tests that can pinpoint specific shoulder conditions. We know that resistance training is valuable, but we need to be mindful of the volume and find what works best for us. And it's crucial to work with a professional who can guide you through the process. But before we move on, I want to circle back to those diagnostic tests for a minute. What were some of the other key takeaways from that first study?
Well, one thing that really stood out to me was the importance of considering the patient's history and symptoms. When interpreting the results of these tests, even with a high likelihood ratio, a positive test result doesn't automatically mean you have the condition.
So it's not just about looking at the test results in isolation.
Right. You need to take a more holistic view. The clinician needs to consider your individual presentation, including your symptoms, how the injury happened, your activity level, and any other relevant factors.
It's like a detective gathering clues to solve a case.
Exactly. You need all the pieces to get the full picture.
And speaking of clues, the study also highlighted the importance of using a combination of tests to improve diagnostic accuracy. So it's not just about relying on a single test.
Precisely. You need to use multiple tools to get a more comprehensive assessment.
Makes sense. And the specific tests that are most useful will vary depending on the suspected condition, right?
Yep. For example, if a clinician suspects a rotator cuff tear, they might use a combination of tests like the Hawkins-Kennedy test, the empty can test, and the drop arm test.
Okay, those names sound familiar, but remind me what those tests actually involve.
So the Hawkins-Kennedy test involves internally rotating and forward flexing your arm while the clinician applies pressure. It's designed to assess for impingement of the supraspinatus tendon, which is one of the rotator cuff muscles.
Okay, and what about the empty can test? That one sounds interesting.
For that one, you raise your arms out to the side with your thumbs pointing down like you're holding empty cans. The clinician then applies resistance while you try to maintain that position. This test also targets the supraspinatus muscle.
Okay, got it. And lastly, the drop arm test. What's that one all about?
The drop arm test is pretty straightforward. The clinician passively raises your arm to the side, and then you're asked to slowly lower it back down. If you have a rotator cuff tear, you may have difficulty controlling the descent of your arm, and it might just drop suddenly.
So basically, if your arm just flops down, that's a bad sign.
Pretty much, yeah. It's a strong indicator that there might be a tear in the rotator cuff.
Got it. So these three tests, when used together, can provide valuable information about the health of your rotator cuff.
Exactly. And they're just a few examples of the many tests that clinicians can use to assess for shoulder injuries. The key takeaway is that accurate diagnosis relies on a thorough examination that takes into account the patient's history, symptoms, and the results of multiple tests.
This is all really insightful. It's fascinating to learn about the science behind these diagnostic tests and how they can help pinpoint the cause of shoulder pain. But what happens once you have a diagnosis? How do these findings translate into effective treatment strategies?
That's a great question, and it's something we'll delve into further as we continue our look at these trending tidbits.
I'm definitely eager to learn more.
Stay tuned, because next we'll explore how these diagnostic findings can guide treatment decisions and how the research is shaping our understanding of the best approaches for different shoulder conditions.
This is all so fascinating. Thanks for breaking it down for us. We'll be right back.
Yeah, so where were we? Oh, yeah, talking about how once you have that accurate diagnosis, you can really start to think about the best way to treat the injury.
Right. Because, there's so many different treatment options out there. Like, where do you even begin?
Well, it really depends on a few things, like what the specific diagnosis is, how severe the injury is, and what the person's individual needs and goals are.
Okay, so it's not a one-size-fits-all approach.
No, not at all. It's all about personalized care.
So, give me an example. Let's say someone has a minor rotator cuff strain. What would their treatment typically look like?
So for a minor strain, you're probably looking at some pretty conservative treatment options. That like rest, ice compression, elevation, that kind of thing.
The good old RICE protocol.
Exactly.
Yeah.
And then along with that, you might do some gentle range of motion exercises just to keep things moving.
Okay, and then as the pain starts to subside, what happens next?
And then you can start to gradually increase the intensity and add in some strengthening exercises. The goal is to build up the strength and stability of the shoulder joint.
And eventually get them back to doing the things they love.
That's the ultimate goal.
But what if it's not a minor strain? Like, what if someone has a more serious injury, like a complete rotator cuff tear?
Well, in that case, surgery might be necessary to repair the torn tendon.
Okay, so that's a whole different ballgame.
It is. But even with surgery, rehabilitation is still super important.
Yeah, I was going to say, you don't just get the surgery and then you're good to go.
No, definitely not. You still need to go through a rehab process to regain strength, flexibility, and function.
So whether you have a minor strain or a major tear, rehab is a key part of the recovery process.
It really is. It's what helps people get back to their lives.
And I imagine that's where physical therapy plays a huge role.
Oh, absolutely. A skilled physical therapist can work with you to develop a tailored program that addresses your specific needs.
So it's not just about handing you a generic sheet of exercise.
Nope. It's about creating a personalized plan that takes into account your range of motion, strength, pain levels, and any functional limitations you might have.
Like a personal trainer for your shoulder.
Exactly. They're there to guide you through the entire recovery process.
That's really reassuring to know, especially for people who are dealing with a serious shoulder injury.
Yeah, it can be a long road, but having the right support can make all the difference.
Now, I'm curious about something. You mentioned that surgery might be necessary for a complete rotator cuff tear, but are there any other treatment options available? Like, what if someone doesn't want surgery or isn't a good candidate for it?
Well, there are a few other things that can be done depending on the situation. Sometimes injections can be helpful, like corticosteroid injections can reduce inflammation and pain.
Okay.
And there's also something called platelet-rich plasma, or PRP therapy, which involves injecting a concentrated solution of platelets from your own blood into the injured area.
And what does that do?
Platelets contain growth factors that can help promote healing and tissue regeneration.
So it's kind of like giving your body a boost of its natural healing power.
Exactly. And then there's also stem cell therapy, which is still pretty experimental, but shows some promise.
Oh yeah, stem cells. I've heard about those. What's the idea behind using them for shoulder injuries?
So stem cells are these unique cells that have the ability to differentiate into various types of cells, including bone cartilage and muscle. So the idea is to inject these stem cells into the injured area to help repair and regenerate the damaged tissues.
Well, that sounds pretty sci-fi.
It does. But like I said, it's still early days for stem cell therapy. More research is needed to really understand its effectiveness and long-term outcomes.
But it's definitely an area to keep an eye on.
Oh, for sure. Regenerative medicine in general is a really exciting field with a lot of potential.
So it sounds like we have a lot of options when it comes to treating shoulder injuries.
We do. And it's important to work with your healthcare provider to figure out the best approach for your individual needs.
Okay, so we've talked about diagnosis, we've talked about treatment, but what about prevention? Is there anything people can do to prevent these injuries from happening in the first place?
Yes, absolutely. Prevention is key when it comes to shoulder health. And there are a few key things people can do.
Like what?
Well, first and foremost, strengthening the muscles that support the shoulder joint is crucial.
Okay, so we're talking about those rotator cuff muscles and the muscles around the shoulder blade.
Exactly. Those muscles act like dynamic stabilizers, helping to control movement and protect the joint from excessive stress.
So it's like having a team of bodyguards surrounding your shoulder, keeping it safe from harm.
I love that analogy. And there are tons of exercises you can do to strengthen these muscles.
Like what? Give me some examples.
Well, some good ones to start with are rows, shoulder presses, and rotator cuff exercises like internal and external rotations.
Okay, I've definitely heard of those. And it sounds like variety is important here.
It is. You want to make sure you're working all the muscles around the shoulder joint to ensure balance, strength, and stability.
Makes sense. And what about flexibility? How does that play into shoulder health?
Flexibility is just as important as strength. Tight muscles can restrict movement and put extra stress on the joint, which can increase your risk of injuries.
So stretching is just as crucial as lifting weights.
Absolutely. And it's important to stretch all the muscles around the shoulder, including the chest, the back, and the neck.
Any specific stretches you recommend?
Sure. So a good one for the chest is the doorway stretch, where you stand in a doorway with your arms raised and elbows bent, and then lean forward until you feel a stretch in your chest.
Okay, I've done that one before. And what about the back?
For the back, you can do a simple cat-cow stretch, which involves getting on your hands and knees, and then alternating between arching your back like a cat and dropping your belly like a cow.
I'll have to try that one. And what about the neck? Any good stretches for that?
For the neck, you can just gently tilt your head from side to side and then forward and back. Just make sure you're not forcing anything. Just go to a point where you feel a gentle stretch.
So stretching strength training, it sounds like there's a lot we can do to keep those shoulders healthy.
There is. And the best part is that it doesn't have to be complicated. Even a few minutes of dedicated shoulder care each day can make a big difference in preventing injuries and keeping those shoulders feeling good.
It's all about being proactive and taking care of your body.
Exactly. And if you're not sure where to start or you have any specific concerns, it's always a good idea to consult with a physical therapist or certified personal trainer.
They can help you develop a personalized program that meets your needs.
Yep. And they can also teach you the proper form for exercises and stretches so you can avoid injuries.
Okay, so we've got strengthening, stretching, and seeing a professional if needed. What else?
Another important aspect of prevention is proper mechanics.
What do you mean by that?
So, proper mechanics refers to the way you move your body during everyday activities and exercise. When it comes to the shoulder, this means using good posture, avoiding awkward positions, and using proper form when lifting objects or exercising.
Okay, so it's not just about what you do, but how you do it.
Exactly. For example, if you have poor posture and your shoulders are rounded forward, it can put extra stress on the muscles and joints, increasing your risk of injury.
So like when you're sitting at a desk all day, you need to make sure you're not slouching.
Exactly.
Mm.
And when you're lifting something heavy, you need to make sure you're using your legs, not your back.
And avoid any sudden jerky movements.
Right. It's all about moving smoothly and with control.
These are all great tips that we can easily incorporate into our daily routines.
They are. And it's amazing how small changes in our movement patterns can make a big difference in protecting our shoulders.
So it's all about being aware of how we move and making conscious efforts to protect our shoulders.
Precisely. And remember, prevention is always the best medicine. By taking steps to strengthen, stretch, and improve our mechanics, we can significantly reduce our risk of shoulder injuries and enjoy a lifetime of pain-free movement.
Okay, so to recap, we've talked about the importance of accurate diagnosis, the wide range of treatment options available, and the key steps we could take to prevent shoulder injuries in the first place.
It's been a pretty comprehensive overview.
It has. And I think it's really empowering to know that we have so much control over our shoulder health.
I agree. It's not just about luck or genetics. We can all take steps to keep our shoulders healthy and strong.
But, as I've been thinking about something. We've mentioned the rotator cuff a few times, and we talked about the muscles around the shoulder blade. But what about the shoulder blade itself? Doesn't that play a role in shoulder health too?
Oh, absolutely. The shoulder blade or scapula is often overlooked, but it's a crucial part of the shoulder complex.
So why is it so important?
Well, for starters, it provides a stable base for the humerus, which is the upper arm bone. It also plays a vital role in shoulder movement and stability.
So it's kind of like the foundation of the shoulder.
Exactly. If the foundation is weak or unstable, the whole structure is compromised.
And what can go wrong with the scapula?
Well, one of the most common issues is something called scapular dyskinesis, which basically means that the scapula isn't moving smoothly or efficiently during shoulder movement.
Dyskinesis. That sounds kind of complicated. What causes it?
It can be caused by a variety of things like muscle imbalances, postural problems, or even previous injuries.
So it's like the orchestra is out of tune. The musicians are all there, but they're not playing together harmoniously.
That's a great analogy. And when the scapula isn't moving properly, it can create excessive stress on the shoulder joint, leading to pain, inflammation, and even damage to the rotator cuff tendons.
Yikes, that doesn't sound good. So how do you fix it?
The good news is that scapular dyskinesis is often treatable with the right exercises and therapies. A skilled physical therapist or athletic trainer can assess your scapular movement and design a program to address any specific imbalances or weaknesses.
So it's like giving those scapular muscles a personalized training session.
Exactly. They'll focus on strengthening the muscles that control scapular movement, improving flexibility, and retraining proper movement patterns.
That makes sense. And what about prevention? Is there anything we can do to keep our scapula healthy in the first place?
Absolutely. Maintaining good posture is crucial, as is ensuring you're using proper form when lifting weights or doing other exercises that involve the shoulders.
So it circles back to those fundamentals, posture and proper form. They seem to be recurring themes when it comes to shoulder health.
They are. They're essential for a healthy and resilient shoulder. By focusing on these basic principles, you can go a long way in preventing scapular dyskinesis and keeping your shoulders feeling their best.
This has been a fascinating deep dive into the world of shoulder injuries. We've learned so much about diagnosis, treatment, and prevention. And it's clear that research is constantly evolving our understanding of how to best care for these complex joints.
It's an exciting time to be involved in this field. Yeah, it really is. There's always something new to learn. And as we've been talking about all this stuff, I keep thinking about how important it is to actually put this knowledge into practice.
Yeah, absolutely. It's one thing to understand all the science and the research, but it's another thing entirely to actually apply it to your own life.
Right. So I'm wondering, what are some key takeaways that you hope listeners will walk away with today?
Hmm. That's a good question. Well, first of all, I think it's really important to emphasize that if you're having shoulder pain, you should see a doctor or physical therapist. Don't just try to tough it out or self-diagnose because, as we talked about earlier, getting an accurate diagnosis is really the first step to getting the right treatment.
Exactly. You need to know what you're dealing with before you can start trying to fix it.
And then once you have a diagnosis, it's important to be an active participant in your recovery. You work closely with your healthcare team, follow their recommendations, and do your exercises.
Yeah, it's a team effort for sure. You and your healthcare provider are working together to get you back to feeling your best.
And that means communication is key.
Right. Absolutely. Don't be afraid to ask questions, express your concerns, and advocate for your needs.
And as we discussed earlier, treatment isn't always just about addressing the injury itself. Sometimes you need to look at the bigger picture and consider things like posture muscle imbalances and movement patterns,
Right. It's about taking a holistic approach to shoulder health.
like treating the root of the problem rather than just the symptoms.
Exactly. And remember that shoulder health is an ongoing process. It's not something you achieve overnight. It requires consistent effort and attention over time.
So what are some things people can do on a daily basis to maintain healthy shoulders?
Well, I always recommend incorporating some simple exercises and stretches into your routine. Just a few minutes each day can make a big difference.
And pay attention to your posture throughout the day. Sit up straight, stand tall, all that good stuff.
Yep. And be mindful of your mechanics when you're lifting or carrying objects. Use your legs, not your back.
These are all great tips that can help prevent injuries down the road.
They really are. And the more you know about your shoulders, the better equipped you'll be to take care of them.
Absolutely.
Mm.
So we've covered a lot of ground today. We talked about diagnostic tests, treatment, approaches the importance of the scapula preventive measures.
Yeah, it's been a pretty comprehensive deep dive into the world of shoulder care.
And I think it's safe to say that we've learned a lot.
I agree.
So for all of you listening out there, we hope you found this episode informative and empowering.
We want you to feel confident in your ability to take care of your shoulders and to know that you have options if you do experience any problems.
Remember, shoulder health is within your reach. It just takes a little bit of knowledge, effort, and attention.
And if you ever have any questions or concerns, don't hesitate to reach out to a qualified healthcare professional.
They can help you on your journey to happy, healthy shoulders.
So until next time, stay curious, stay active, and stay healthy.
See you later.